Hello everyone, it's Dr. Shiva Ayyadurai. Today we're going to be talking about spinach and cardiovascular health. What is spinach? It's known as Beta vulgaris. That's its official Latin term. It's a root vegetable that was domesticated first in the Middle East and native to Europe. It belongs to the Amaranthacea family. Ancient Romans and Greeks used spinach as an aphrodisiac. Its medicinal use dates back to Hippocrates, and its medicinal properties are attributed to both the leaves and the root also. And if you look at the cardiovascular system, you notice it consists of the lungs, the heart, the vasculature, and blood. Now, blood isn't just composed of red blood cells, which carries oxygen, but it's also composed of white blood cells, which help support your immune system. So the blood is composed of blood cells and plasma. The inside of the arteries and the inside of the veins and the inside of the capillaries are composed of endothelial cells. And you'll see this is very important to understand the biophysics here. There's been close to 9,696 research articles done over the past 80 years on spinach. In fact, there's been over 76 clinical trials. We're going to look at the body of that research relative to its effect on cardiovascular health. And the way we do this is with a technology that I created for my PhD work at MIT that's now grown into its own company called CytoSolve. The way CytoSolve works, if you look at the body of literature, let's say spinach and cardiovascular health, we're able to look at all of that research and we're able to mine that research and curate it to the relevant ones that have molecular mechanisms. And then we're distilling that. In this case, the area that we're interested in is cardiovascular health. We're going to then extract those pieces of research and then amalgamate them together to get a systems view about spinach's effect on cardiovascular health. We've been helping lots and lots of other companies use CytoSolve, really cool companies, to figure out the combinations of ingredients. If you go to the vitamin store right now, just like in some ways Big Vitamin is getting as bad as Big Pharma, they just throw all sorts of crap into these vitamins and you don't really know what works. What we've done is to take that snake oil out of the way by really trying to understand the biomolecular processes and what are the combinations. Because if you look at food products, they're not just one ingredient like pharma uses a single compound. There are many, many ingredients. So with CytoSolve, for example, what we can do here, this is our first product that we've decided to do on our own. And we were very, very careful in doing this because we wanted to make sure we could do it the right way. But MV25 is a product that you can go find up on the shop site. But MV25 is really a blend of bioflavonoids that are formulated to relieve discomfort and support the body's natural inflammatory processes. And we say it's CytoSolve optimized, so we integrated thousands of peer-reviewed literature across 4 decades, 68 research institutions, and then we computed trillions of molecular reactions to find the right synergy of these bioflavonoid compounds.
Hi, I'm Barbara Ann. My hands would cramp up so that I couldn't hold cards or knit or crochet, and they would go like that. And I'd have to use this when I played cards with my grandkids. And I started taking that MV25. After a bit, I was able to hold cards in my hand. Very, very little cramping, hardly at all anymore. MV25.
Hi, my name is Sandy. I'm a Taekwondo instructor. I tore my ACL during Taekwondo. I had a lot of pain and limited mobility. I've been taking the MV25 for about 6 months now. After the first week, I noticed a big difference. After the second week, almost literally no pain.
My name is Jeremy, and I suffer from a lower back problem. Hurt my back at work years ago, and I can go to the chiropractor, do all kinds of different things, and nothing seems to help. And I decided to try MV25. I didn't notice a difference immediately, but within a few days, the pain went away, and it stayed away. I've continued to take it, and even when I do things that I shouldn't do, it seems to go away a lot quicker than it ever did before.
It's clean food certified. It's made in the US. If you go to vashiva.com, right on the shop, you'll click there, or you can go right to mv25.life, either way. And then from there, you can click on the bottle and you can order. If you buy 6 bottles, you get 6 bottles for free. Please take advantage of it because first of all, it's going to help you. It's going to help our movement, and it really supports the fact that we want to take science-based approaches to natural products. So when we go back to spinach, we have to also recognize spinach is a food, okay? And as a food, it's not just one compound. It's composed of macronutrients. Macronutrients are things like fiber, proteins, and fat. It also contains micronutrients, which are the vitamins, carotenoids, betalains, minerals, phenolic compounds, and the inorganic nitrates. Out of all the many different compounds in spinach, these 5 compounds have been the most well studied. So what are the biological effects of spinach? Well, it's an anti-inflammatory, antioxidant, antimicrobial, anti-hyperlipidemic, which means it breaks up fat, anti-hypertensive because it lowers hypertension, and it modulates the immune system. Now, the health benefits of spinach, cardiovascular, diabetes, hepatitis, and infections, we're going to focus on cardiovascular disease relative to hypertension, arteriosclerosis, and heart failure. This is your capillary. So as you say, your blood flow over the endothelial causes NO production, endothelial nitric oxide synthase, ENOS, converts L-arginine to NO and L-citrulline. And the NO production leads to vasodilation and it maintains your blood pressure. So this is one of those tiles on the surface of your capillaries, the endothelial. And what you see here is there's a little Christmas tree structure here called the glycocalyx. So when blood flows over that, this starts shaking. So this moves and it starts a whole series of chemical reaction that results in the conversion of L-arginine to nitric oxide by the enzyme ENOS. Using CytoSolve, we looked at the effect of spinach on cardiovascular health. So spinach is shown to have anti-hypertensive effect, anti-diabetic, and anti-arteriosclerotic effect. Let's look at the anti-hypertensive effect. So hypertension, when your muscles are not relaxed. Nitrate in spinach, when you chew it, goes through your mouth, nitrate is converted to nitrite. The nitrite decomposes to NO, and NO is critical in converting GTP into SGMP, which allows for vasorelaxation. The other effect is the betanin from spinach also supports anti-diabetic effect, along with the apigenin. So the apigenin, the bioflavonoid, and the betanin support the creation of NRF2. Knocking out of the superoxide, knocking out of the hydrogen peroxide prevents endothelial dysfunction, preventing diabetes. The next thing is anti-arteriosclerotic effect, which is hardening of the arteries. Here, the betanin from the spinach and the carotenoids in the spinach, they stop the function of superoxide. When you have endothelial dysfunction, your body produces more of the superoxide, which you don't want. The carotenoids in the spinach and the betanin block this. With superoxide, LDL, which is a low-density lipoprotein, which is a bad cholesterol, gets oxidized to OXLDL, right? Which is the oxidized form of LDL. And this is what causes plaque formation. So the superoxide, which does this, is knocked out by carotenoids and the betanin. So that's the pathway. Again, the power of spinach. In the systems learning approach, we also teach you an engineering systems approach, integrating Eastern and Western medicine. And in that system of medicine, I'm going to share with you, you can look at things from a molecular systems approach, but you can also look at it from a engineering or an Eastern systems approach. Using that approach, we can look at spinach. What you notice is spinach actually increases transport, the motility functions in your body. It stabilizes digestive function. It stabilizes kapha, which is storage, or the storage function, which means it helps the storage of fat, for example. So that's the Eastern approach. How much should you take? Well, this is all based on the recent research. Tural et al. In 2020 said spinach extracts for coronary heart disease. You can find spinach extracts in about 100 milligrams per kilogram. Betanin supplement, which you can get, which is good for glucose control. People who are, let's say, diabetics. Again, 100 milligrams per kilogram extract. That's in Han et al. 2015. Now, the spinach juice for hypertension, 250 milliliters per day. Again, this is not a medical show, but it's giving you what's in the research and what CytoSolve is reflecting. You should obviously talk to your doctor before this, because remember, the raw spinach has more oxalates in it. So in summary, spinach has several benefits to cardiovascular health. The nitrate in the spinach, remember, it releases a vasodilator, nitric oxide, which lowers hypertension. Spinach promotes upregulation of antioxidant enzymes that mitigate diabetes via the downregulation of endothelial dysfunction caused by oxidative stress. Third item important here is spinach compounds prevent arteriosclerosis by downregulating those oxidative stress molecules that cause plaque formation and hardening of the arteries. All right, so there you go. So today we've covered spinach and cardiovascular health. I hope you enjoyed it. Thank you. Be well.